Sickle Scalers. Sickle design. A sickle scaler is a periodontal instrument used to remove calculus deposits from the crowns of the teeth. Sickle scalers should not be used on root surfaces. The working end of a sickle scaler is triangular in cross-section. This design limits its use to supragingival instrumentation. It has a pointed tip and two cutting edges per working end. The face is perpendicular to the lower shank so that the cutting edges are level with one another. Level cutting edges mean that the lower shank must be tilted slightly toward the tooth surface to establish correct angulation. Technique practice: sickle scaler on anterior sextant. As an introduction to using a sickle scaler on the anterior teeth, first, practice on the mandibular left central incisor facial aspect. Before beginning, take a moment to self-assess your position and your patient's position. Correct them now if needed. Throughout this technique practice, stop every so often to reassess position and grasp and correct them if necessary before proceeding. Position the working end near the midline of the left central incisor. Establish a 70 to 80 degree instrument to face-to-tooth surface angulation. The tip should be aimed toward the mesial surface of the tooth. Use overlapping strokes as you work across the facial surface in the direction of the mesial surface. Roll the instrument handle slightly between strokes to maintain adaptation. As you approach the mesiofacial line angle, roll the instrument handle to maintain adaptation of the tip third of the working end. Continue making strokes as you work your way along the mesial surface. Check to make sure that you have maintained an angulation of 70 to 80 degrees. Continue strokes until you work at least halfway across the mesial surface. The other half of the mesial surface will be instrumented from the lingual aspect of the tooth. Technique practice: sickle scaler on posterior sextant. As an introduction to using a posterior sickle scaler, first practice on the mandibular right first molar. Before beginning, take a moment to self-assess your position and your patient's position. Correct them now if needed. Throughout this technique practice, stop every so often to reassess position and grasp and correct them if necessary before proceeding. First, select the correct working end. Use a tooth that is easily seen, such as the first premolar. Establish a finger rest and randomly place one of the working ends on the distal surface. Study this working end. Note that the lower shank is not parallel to the distal surface. Also, the functional shank is down and around the tooth. This is the incorrect working end. Look at the opposite working end. Note that the lower shank is parallel to the distal surface and the functional shank goes up and over the tooth. This is the correct working end. Begin at the distofacial line angle. The tip should aim toward the back of the mouth because this is the direction in which you are working. Work around the line angle and on the distal surface. Work at least halfway across the distal surface from the facial aspect. Pause to check your angulation. Remember that the sickle's face is at a 90-degree angle to the lower shank. If the lower shank is parallel with the distal surface, the face-to-tooth surface angulation is 90 degrees. The lower shank must be tilted toward the distal surface to establish correct angulation of between 70 and 80 degrees. While maintaining your fulcrum, lift the working end away from the tooth and turn it so that it aims toward the front of the mouth. Reposition the working end at the distofacial line angle. Work across the facial surface. As you approach the mesiofacial line angle, roll the instrument handle slightly to maintain adaptation. Tilt the lower shank slightly toward the mesial surface to maintain correct angulation. Work at least halfway across the mesial surface from the facial aspect. The other half of the mesial surface will be instrumented from the lingual aspect.